Hi, I'm Michelle Van Ryn. I'm really delighted to be here. Some of you know that I actually was at the University of Minnesota from 2004 to 2013, and it kind of feels alarmingly like coming home. So what I'm going to talk about today requires a little exercise right now, and I want you to bear with me. What I would like you to do is just take a few seconds and think about your deep core values that bring you here today. Think about what you value, how it connects to your purpose. So just really focus on that just for a few seconds. Feel free to continue doing that throughout the talk. So I'm Michelle Van Ryn. I wear two hats. I work at Mayo Clinic, and what I do there is direct a research program, and my focus there is a typical academic focus. I also recently started a side business, and I did that because I got frustrated with the limits on what actions I could take as an academic. And the fact that we keep doing more studies, which are necessary, but aren't necessarily translating them into practice. So one disclaimer, Mayo Clinic is entirely neutral to my business. It does not support it. It does not care about it. It's not linked. The other thing I want to do is acknowledge co-authors who have worked with me over the years, and so therefore their ideas are in here in ways that are always difficult to disentangle. One of them is actually Dr. Hardiman, who just will, in that chair, she'll be back, I'm sure. And my other colleagues, Dr. Phelan, Dr. DeVideo, Dr. Rulo, among others. So there's quite a large cast of characters. So what I'm going to do is I'm going to provide a little bit of background, which is some of the challenges and opportunities that are rooted in human automatic processes, and then where I am now, my current thinking on actions to take to reduce discrimination in healthcare. So one of the things that I didn't do is I didn't put up a whole set of slides documenting or showing the documentation of racial and other disparities in healthcare. So I'll just say it now. There's over 1,000 studies showing that Black Americans are less likely to get cutting-edge, guideline-concordant care than white Americans, that this is partially due to insurance. Insurance is a big ticket. It's also somewhat due to site of care, but it persists independent of site of care. So there's massive evidence of disparities in healthcare. I'm focusing today on race, ethnicity, which is socially constructed, as we know, and gender, but that does not at all mean that there aren't other groups that are heavily marginalized and experiencing some of these adverse events and ill outcomes. There's many, not too many to list. So I want to talk about some of the challenges that are presented by some of the automatic ways we respond to world. Sometimes I don't know what the title is, so the other title is Automatic Responses That Maintain Advantages for White People, or The Problem of Human Nature. So let me go through this pretty quickly, because this issue about unconscious bias is all over the news now when I first started it. So we don't necessarily we're not super aware of how we actually experience the world. But there's agreement that we have at least two processes. One is the one that we think controls our behavior. One is the one that we're aware of. One is the one that you are engaging as you try to understand, think, and connect ideas. And the other one is the one that's actually controlling 70% of what you're doing right now, at least. That is fast, it's automatic, it's reflexive, it's extremely efficient. So I'll give you a couple examples because it's interesting because it has something to do with not being able to see the floor on which we stand. So right now, that part of your brain is keeping you sitting in a seat. It's keeping you most of you eyes forward. It's keeping you at least mimicking attention, so thank you. There's a lot of things that happen and we don't notice it. Okay. This system is extremely developed because we are surrounded by millions of bits of information, and we need to know what to pay attention to and what is relevant, and it guides that. The other piece, so I'm going through this kind of fast because I've got 30 minutes and I'm going to get to some of the strategies. So one of the things that you may have heard about is the fact that implicit biases create an automatic activation of beliefs that aren't the same necessarily as our conscious motives. So, for example, 80% of white Americans have some level, moderate to severe, automatic negative associations with Black Americans. That's one example. Actually, gender is another one that I'll mention super quickly because we were just talking about it. In the case of Black Americans, the automatic negative associations are pretty much evenly distributed among Black Americans, so there's just kind of a nice normal curve. When it comes to gender, gender bias is as high in women as it is in men. So, the other piece, though, that I think we aren't paying attention to when we talk about how we are wired to experience the world very rapidly through this framework, the other piece that hasn't been talked about enough, and I blame myself, is the fact that it is motivated. There are motives also. So that part of our brain automatically acts to serve motives in the way that it thinks would best serve those motives. It's very outdated. It's obsolete. We can't say why, but it clearly evolved in a very different kind of world where people who looked just like us were actually people who were members of our in-group that we should take care of, and people who didn't were not. That is not the case anymore, but that part of our brain is pretty well embedded. So we have motives. We want to maintain self-concept, so we activate certain perceptions to support our self-concept, which means that anything that harms our self-concept is likely to make us more racist, sexist, biased. We also are motivated by survival and survival of progeny, otherwise known as children. That is so heavy, so strong, that the actual restraint of the Black Lives Matter movement amazes me. It amazes me. We are so motivated to protect our children. And so that part of our brain will respond to the world in ways that it is programmed to believe it's most likely to protect ourselves and our children. So I mentioned that this is outdated. I'm going to go forward with this slide. And I want to give you some case examples. So for the longest time, in auditions, men were hired at much higher rates than women. When they were auditioning behind a kind of a screen so people couldn't see gender, women are actually getting hired at slightly higher rates than men. So what is this case? What's happening here? So some of what's happening is the fact that there is an automatic expectation that men will be better musicians, they're better at math, better at other things. When these associations make us pay attention, we have selective attention to things that are consistent. So this happens really automatically, but it affects our conscious cognition, right? So this is explicit then. So we pay attention to errors for people we think are less competent automatically, and we pay attention to positive qualities. So the other possibility is it's explicit bias. And then the last and there's probably all of this, but the last one is that part of our brain thinks we're much better off if we're surrounded by people like us, right? As I said, it's pretty outdated, both in what it classifies as people like us and that assumption. So part of that is sort of a motivated desire for the people who are doing the hiring, who are primarily male, because as I said, that there's been that higher level, to perhaps protect them. So perhaps it's motivated. So I can't get inside their brains and know that, but I can tell you that there's probably hundreds of studies in social psych labs supporting these phenomena. So the other thing that I think is really important, and I'm going to get into this issue of emotional empathy, but the biggest thing about this part of our brain is it guides us through emotion, right? So one of the very first things that happens, because this brain needs to figure out the world as part of our brain very fast, is we very, very, very quickly have an affective flash. That is some kind of emotion. Jonathan Haidt, who's a social psychologist and an ethicist and a philosopher, classifies it as towards or away, and then the third one is neutral. Everything we do after that can be affected by the need to justify those feelings, as well as the effect of those feelings on the way that we are seeing the other. I'm going to give you one more case example. that's not healthcare necessarily, although it's very relevant to healthcare. So this is pretty recent. The exact same resumes were sent out to 1,300 want ads. Some had black-sounding names, some had white-sounding names, but otherwise were identical. The callbacks, I'm not really sure what's happening with my slides here, but I'm sorry about that. The interest in the employers was 50% higher for the white-sounding names for the identical. Then they did this new manipulation. So this is kind of key. They increased the qualifications. So they had whites with medium qualification, whites with high levels of qualification, right? White-sounding names, black-sounding names, medium, high. The white-sounding name group benefited from higher qualifications. The black-sounding name group did not. And now this is, I want to say this because I want you to go forward thinking about the notions of the way that we evaluate merit, okay? This is our field. This is women. Science faculty evaluated applications that were identical except for randomly assigned gender. They thought the man was more competent. The randomly assigned group that got the male name applicant rated that applicant as more competent, more hireable, more desirable as a mentee, and maybe some women here have had this experience. And also, when asked what the starting salary would be, said that they deserved a starting salary that was on average $4,000 higher than when the group that got the female applicant. So what I'd like you to do is look at this face and your first gut sense about what this man is feeling, right? I'm not going to ask you, but be honest with yourself. What is that man feeling? He's looking at you. What's he thinking? What's he feeling? Okay? Look at this guy. He's looking at you. What's he thinking? What's he feeling? White people, like me, interpret facial expressions that are identical for black individuals as more hostile. Okay? They interpret facial expressions as more hostile. Tend to interpret black facial expressions of sadness as anger. So this part of our brain filters what we see and labels it as threatening or not through both in-group bias and a repeated association of black faces with negative attributes in the media in a way that's self-perpetuating. We tend to, and when I say we, now I'm talking to the white people, okay? We tend to then view our black colleagues, black individuals, black teens, black children through that lens. And often what happens is that creates a self-justification for returned hostility, an assumption of hostility. The other thing that this part of our brain doesn't like is stereotype inconsistency, because it's very, very motivated to, like, again, I'm talking about it like it's another person, and sometimes that's how I feel about it. And you can even think about it. It's a part of us that we don't notice, but it's guiding us all the time. It doesn't really like it when what it expects doesn't show up, because that would suggest that we maybe don't know about the world and maybe our survival is threatened. Okay, so I'm kind of, extrapolating there a little bit. And this is really problematic. So given the same performance evaluation, when women performed well in traditionally male jobs, they were ranked high in competence but low likability. The identical scenario for men, the men were seen as more pleasant as his competence increased. As women's competence increased in terms of the document, their likability went down. Their perceived likability, not their actual likability. These are actually made up people on a randomized study. As men's competence increased, their likability went up. So there's another factor here at play. in creating the dynamics that Dr. G described. One of the things that happens, and this is what is fascinating to me about the idea that committees are going to fix this, or even diversity on committees is going to fix it, is we share this stuff. This is common. This is socially constructed, shared perceptions. Our identity is very malleable. Our way of looking at the world is very malleable. So we mutually reinforce it. So one of the things that I would say as a search committee is what you might hear is someone's not ready. So what's actually happening there is everyone is looking at a candidate. They're automatically activating, let's say, if it's a leader position, the image of leader. So if you actually think for a second what comes to mind is leader, for most of you it's going to be man. And most of you it's going to be a white man. And if you do a Google search on leader, what you're going to come up with mostly is white men. Sometimes Martin Luther King shows up. So we have this automatic association. This part of our brain creates that association. So now we have a woman. A woman's in front of it. That's uncomfortable. We seek always a reason for that, right? Why am I uncomfortable? And often that reason is something located in the person. Not ready, not comfortable with this person. Maybe isn't a good leader. Let's pay attention to all the negative qualities. I see that perhaps this person is difficult. Everyone in that search committee is relieved because somebody's provided an explanation for their discomfort. So then women, this happens, I get phone calls about this all the time. Women say, I do not get it. Why was I overlooked? And what they hear is, well, the search committee was in agreement and there were 3 women on that search committee. So it's obviously fair. You obviously just don't measure up. Biases are self-propagating. We propagate them. So women in recommendation letters are more often described as students, teachers, men as researchers and professionals. Women are often described in terms of their personal lives. In recommendation letters for men, it almost never comes up. So it reinforces an association between women and family and men and career. There are differences in the words used as well. Biases are self-propagating. We see these pictures, so there's 2 ways here. There are 2 pieces here. One, most of you have probably seen this. You see that this is Hurricane Katrina. This young man is walking with some food, and he's described as looting. The white couple is walking with some food, and they're described as finding. So there are 2 things here. Obviously, they're not usually like this. You see them separately. It reinforces a negative view, right? But the other piece is that the actual description is based on automatic biases. We tend to attribute negative motives, negative attributions to racial and ethnic minorities, and again, now I'm saying for white people, and we tend to attribute situational or perhaps even positive explanations for white behavior. Here's something that has come to me very, very painfully. Rachel, do you know what I'm doing on time? No? Okay. I tend to go on, which is very inconsiderate to the next speaker, so I don't want to do that. So one of the things that we are wired to do is to actually feel a strong sense of connection when people who are like us visually are in pain. So fMRI studies show that if my shoulder gets hurt, if you connect with me, you think of me as sort of like someone in your in-group, like maybe I would be someone who would take care of your kids, make sure you're okay, right? That part of your brain. Part of your brain that would light up if you hurt your shoulder would light up. The studies show that that is not the case. That level of empathy, sort of emotional responsiveness, is not the case across race. Those are some of the images from the study. I told this story, and I guess I'm going to tell it again, even though I feel really vulnerable when I tell it. So I've gotten pretty close to someone I work with at Mayo. We've worked on a lot of things together and shared a lot of, and we've created kind of an in-group because we both have some goals that are maybe not shared by those around us, so that creates bonding. We're on a diversity committee. This person, who I don't want to name, and is not Rachel, Just so you, because someone said, is that Rachel when I told the story? And I'm like, no. Anyway, on a diversity committee, and she's sobbing, and the white people are looking at her, right? Me too. I'm like, what's wrong? And she said, I cannot do this today. And I'm like, what? Another black child had been shot that day. And she said, I can keep thinking about the parents. Her pain was kind of lighting up. The white people care. We care mentally, but that deep emotional response wasn't there. But here's the good news for our future. She is in my in-group. She was in pain. My pain lit up. I felt it in a very different way. And again, I say that the restraint of the Black Lives Matter movement is remarkable. This emotion pushes the intensity with which we will create change. So I did a like a 5-minute thing a little bit ago on the Ignite, and it was called, working towards health equity and other lies we tell ourselves. And that's, of course, hyperbole. But really, we don't work as hard towards stuff that we don't have that deep emotional connection. Okay, I am running out of time. So the good news and bad news is we're really malleable. So it is possible to change the relevance of group category. There's a lot of ways, right? I just described one. There's a lot of ways to create a sort of sense of common in-group and overcome this. And there are a lot of ways to change what the associations are. They can be and are manipulated, that's what we call it if we don't like it, or improved if we do. And if you actually look at what's happening in our election, what you will see is that a group of people did an amazingly good job activating or manipulating associations that may not be very real. I did a talk at the Workplace Forum last week. I was talking to a woman, white woman, and she said, the students in my program are like really into the Black Lives Matter movement, but my brother is a police officer, so I feel like I can't go with it. I was like, right? And she was like, and I said, so explain that to me. If your child is shot by a police officer, and then that police officer has no repercussions, is that being concerned about making some change? Is that anti-police? Do you see what I'm saying? An association, it can be manipulated. We don't like doing that because we don't want to feel like we're manipulating people. But what I am going to say to you is we better. This is my opinion. I do not represent Mayo Clinic. We better. Because we have outdated and dysfunctional wiring, we need to hack it. We need to create workarounds. Just as if you're using a software program for something it is now not useful for, we have to create workarounds. And we actually know some about how to do that. Okay. I was going to talk about stereotype threat, but I'm going to move through it. It's basically an internalized reaction to the awareness that we can be judged based on stereotypes. It is not internalized stigma. It is just we know we could be viewed through a lens of a group stereotype. There are hundreds of studies showing negative effects, performance decrements, disengagement. It's an unpleasant experience, so we try to stay away from situations, which is one of the reasons why we may be seeing lower rates of African American entering medical school. We don't want to be in those situations. And a whole lot of physiologic effects that some of them Dr. G went through. I'm going to forward to this one. And this one is kind of a funny one because people are like, oh, too bad. White people have something called racist identity threat, and men have something called sexist identity threat. Okay, I got to move this along really fast. My apologies. What we've noticed, what the studies have shown, is that when white people are made aware and that they may be viewed through an assumption of being racist, and we know this is, you see this in another way to call this is like there's white fragility, that actually they experience identity threat, and the effect is similar. It's de-skilling, it's disengaging, it makes them nervous. It actually increases implicit bias. But here's the key thing. When underrepresented minority and other members of devalued groups experience identity threat, it harms them. When whites experience identity threat, the awareness they could be perceived, it harms the underrepresented minorities in an organization. So when I say we have to take that into account in our interventions, I'm not saying, oh, poor white people, we got to worry about that. I'm saying that if we don't, we're going to be continuing our harm. And this is one of the reasons why so many diversity and inclusion efforts are failing and creating backlashes, because they're not paying attention to this. There are individual strategies, but they're very difficult to sustain if an organization has a negative climate. So I have moved from focusing very much on encounters to focusing on organizations. So here's what's hopeful. Organizations can create safe spaces that are bounded. They can, and some have, created environments that provide the kind of learning and growth situation where these things can be brought to the surface, talked about, and dealt with, and the negative effects attenuated. So I'm focusing on organizations. And one of the, I feel so sorry for them sometimes. So so Mayo Clinic has a very high standards for itself. Okay. When the news came that maybe some of this stuff might be affecting the care, it was like, this cannot stand. We must do something. And because they didn't, because I was there, and I don't mean me, but I mean a scientist who pays attention to all the literature, they kind of got stuck doing something different. So the first thing organizations need to do is actually face it, and I think that that's an echo. The question, though, and this is what drives me crazy, the question isn't, is there racism, sexism, and other isms? The question that needs to drive the assessment is, in what ways does it manifest? So you'll notice that with diversity assessment, they're like, well, is there? No, yeah, there is. We know this. We can pretend we don't know it, but we know it. So how is it manifesting? The other thing is we have to stop looking at the symptoms. We have to get at some of the core issues. A benevolent sexist organization will make women feel warm and coddled, but will make them feel as if they have to keep proving they're good at their jobs, and will make women who are very successful be excluded. You will see this. Pay attention to this, right? So it feels nice and warm, right? But women are seen as lower competence. So there's subtle factors here that will not get picked up if we're not really aware of these dynamics. Here's what I would like to suggest organizations do. Conduct an environmental audit. We are exquisitely sensitive to cues about belonging. Really sensitive. Our survival depends on our role in our social surroundings, so we are constantly monitoring. Image, artwork, educational materials, pamphlets. Physical space, what does it say? Who is comfortable in this space with this decor? Who's like, oh yeah, this is the right? Who is like, ooh, right? And when we do this, and when you recommend to all the organizations that they do it, don't let the dominant group, which is almost always, not always white, do it. Get a team of stakeholders to come in and say, how does this feel? What here is not comfortable, is not consistent with your way of being in the world or your way of seeing the world. These are the most common magazines in waiting rooms. This sends a very powerful message about who belongs and how they're supposed to be, right? I'm going to skip that. I'm running out of time. The other thing organizations can do is take every opportunity to remove stereotype-consistent images, teaching, ways of talking, and I'm speaking to myself and my colleagues in the schools of public health and medicine, ways of describing people and describing risk, and take every opportunity to insert counter-stereotype images. It is the one thing that actually changes unconscious bias. It doesn't just interfere with it, but changes it. But it has to be repeated continual exposure. So you need the organization to have it around you because people are going to go home, so they need to come in. And it actually changes it proximally. So people who see counter-stereotypes right before taking an assessment, their implicit bias changes, goes back. So that's another thing. If you see interventions that say they're changing implicit bias because they assess it right after they do their intervention, whoopee. We can all do that. I could do that right now. It's just that it reverts. This is way too complicated to get into. I'm just going to say it and then maybe have some opportunities to discuss this. It's not just that policies and procedures can advantage some groups over others in ways that are clear. It's that there are multiple ways in which implicit bias and identity threat can really pervert or subvert the process. Job descriptions give us cues, and it's been shown that job descriptions that are written in a way that sounds very male discourage women from applying. They may not be, some of this is unconscious, they just like, that isn't my blog. If the job description reflects one culture over the other, it's a subtle cue. There's a lot of places for bias leakage. I described one a little bit ago when I talked about search committees. This is basically, I'm really tired of evaluation criteria that's not specific. Like one of the ones is, decorum, treats others with respect, and we already know that we attribute what people do differently based on their social category. Review your letters of recommendation. What we find is that women get described in terms of personal attributes and effort. Men get described in terms of qualities that, sorry, okay, I gotta get it. Men are described in qualities that are much more compelling. Jane's delightful, John's brilliant, Jamal is hardworking, Jeff's a leader. Okay, I am going to say I'm going to just go right through these. Stress, cognitive overload, increases bias because it overwhelms the conscious part of our brain that can actually interfere with our automatic responses. So this is bad news for healthcare systems and actually educational systems, but lowering cognitive load and stress, it can be very important, especially among people who are motivated to be unbiased. Coaching organizational leaders to practice non-defensiveness, welcome requests to re-examine their decisions for unintended biases, welcome feedback on behavior. So here's an interesting thing that the studies have shown, and that is that a learning and growth approach where people are encouraged to learn from their mistakes in interacting with people of other races actually seems to protect from white stereotype threat. Fearless self-awareness among leaders. Describe their own experiences with perpetuating and experiencing bias. Believe what you're told. This is, I feel very strongly about this. Believe what you are told when people tell you they are experiencing exclusion or discrimination. Right now, de facto, the evidence is on the individual to prove it. How can you prove it? Believe what you're told until you have some very strong evidence to suggest that this is one of those very rare cases where the person is misunderstanding, misattributing, or the common response is manipulating. Assessing group processes, who has the floor, for how long. I mean, really assessing, consciously counting. Whose ideas, opinions get no response, and follow up how often, and bring the conversation back around to those who are interrupted or ignored. Change norms and set an example. This is all leadership coaching that I'm working on. Notice there are some, not just me, there's a whole bunch of people. It's all about me. Fearless examination of your in-group. What you could do right now is think of the 5 people who are not in your family you trust most. And think of what they're like. Who's in your in-group and why? And how can you change that? There's feedback styles that reduce stereotype threat that you can train. Inclusive multicultural diversity philosophy that is everywhere. I don't know why there's a resistance to that, but that it's very specifically written. All members representatives from all members of all groups read it and feel included, feel like they're reflected, and put it everywhere. This is values. There's a lot of known strategies to build team cohesion, to try to create a common in-group identity, which is not everybody act like the white people, okay? That's not what that is. And that's how sometimes it's getting interpreted. Let's all get along as one team. But then what that seems to mean is everybody act like the dominant group. And I would say the universal employee training should start with identity threat because everyone can relate. It triggers our automatic desire to be altruistic. It can trigger a growth mindset. And it starts with helping people learn about identity threat in themselves and others without necessarily triggering all that shame that we experience when we think about all the ways in which we perpetuate white advantage, male advantage, right? High SES advantage. The beautiful thing about that is the individual strategies for identity threat overlap with strategies for preventing automatic bias hijack. The perspective taking skills, partnership skills, emotion regulation skills, positive emotions. I'm going to end here. I like to do something with people because even these topics can trigger identity threat. I can find myself getting de-skilled when I start talking about gender bias. I'll start stuttering. There are ways you can protect yourself, and I have a sort of thing I put online, and there's the website. But I want to thank you for your attention and your patience.